scapula, and this is the left-sided scapula. So first we'll find identification of the bone. So this is scapula. It is a flat bone, flat triangular flat bone situated on the posterolateral aspect of the thoracic cage. So this is the thoracic cage, and here you will find the scapula. So we call it as a triangular flat bone situated on the posterolateral aspect of the thoracic cage. It is a left-sided. Okay, so it is left-sided. How it is left-sided? Why it is left-sided? Lateral angle is broad and forms the cavity that is called as glenoid cavity. Articulates with the head of the humerus and form the shoulder. Okay, and anterior surface is concave, marked by three ridges, costal ridges, marked by three costal. Anterior surface is concave, three costal ridges. Posterior surface is divided into two parts by a spine of the scapula. Okay, so posterior surface we will find the spine, anterior surface concave, lateral angle bears a cavity that is called as glenoid cavity. So and superior border present a notch that is called as suprascapular. So these are the 3 or 4 points so that we can define it as a left-sided scapula. Fine. Now it has got the 3 angles and 3 borders, 3 processes and 2 surfaces. When we talk about the angles, you will find the superior angle, inferior angle, lateral angle. Lateral angle is broad and forms the cavity, glenoid cavity, articulates with the head of the humerus to form the superior angle, inferior angle, lateral angle, 3 borders. Superior border, which is the sharpest border, you will find a notch, suprascapular notch here, and the superior border. Medial border extends from the superior angle to the inferior angle. It is a thin border. Lateral border extends from the lateral angle to the inferior angle. It is a thick border. It acts as a lever. Okay. So it is the thickest border. Lateral border extends from the lateral angle to the inferior angle. So we have seen the 3 angles and 3 borders. Okay. Now we talk about the 3 processes or surfaces. Now we will talk about the surface. Anterior surface is concave surface. It is also called as costal surface because it faces the costa ribs. It faces the ribs. So it is also called as costal surface. It is marked by 3 costal ridges. Posterior surface is divided into the 2 parts by a spine of the scapula into the supraspinal fossa and infraspinal fossa. Okay. So 2 surfaces we have discussed about that, and now we talk about the 3 processes. First of all, we'll talk about the spine of the scapula. What is how you will define the spine of the scapula? It is a triangular thin plate, bony plate, a thin plate of the bone. Okay, triangular plate of the bone we call it as a spine of the scapula, which divides the posterior surface into the supraspinous fossa and infraspinous fossa. It has the 3 borders. First, one border is anterior border, which is attached on the posterior surface, posterior border and lateral border. 2 surfaces, superior surface, inferior surface of the spine of the scapula. Okay, posterior border is thick and it has the 2 lips, upper lip, lower lip. Posterior border is thick and it is called as crest of the spine. Okay, crest of the spine, and the crest of the spine has the 2 lips, upper lip and lower lip. Okay, this was the spine of the scapula, and you will find a process that is called as acromion process. Acromion process has the superior 2 surfaces and 2 borders. Superior surface, it is like that, in anatomical position it will be like that. So you will find here the superior surface and inferior surface, lateral border and medial border. So you will find the inferior lip, lower lip of the crest of the spine is continuous at the lateral border of the acromion process. Upper lip of the crest of the spine is continuous at the medial border of the acromion process. So acromion process bears the 2 borders and 2 surfaces, upper surface and lower surface, 2 borders, medial border and lateral border. Okay. Now you will find at the anterior and inferior side of the acromion process, you will find one more process that is called as coracoid process. It is also the superior surface and inferior side. Done. So we have talked about the 3 angles: superior angle, inferior angle, lateral angle. 3 borders: superior border, medial border, lateral border. 2 surfaces: anterior surface, posterior surface. Three processes: spine, acromion, rubber process. Done? Okay. So you will find a notch between the spine and glenoid cavity here. So this notch is also called as spino-glenoid. Spine and between the spine and glenoid cavity, so it is called as spino-glenoid notch. Superior border presents a notch that is called as suprascapular notch. Now we talk about the muscle attachment. Okay. So costal surface, medial two-third of the costal surface gives origin to the subscapularis, or it is also called as subscapular fossa. The medial two-third of the anterior surface is called as subscapular fossa, gives origin to subscapularis, origin of one muscle. Okay. Now there is an insertion of one muscle that is called as serratus anterior muscle on the anterior surface of the medial border. So this is the medial border, and you will find the anterior surface of the medial border from superior angle to the inferior angle. So serratus anterior muscle is inserted on the anterior surface of the medial border from the superior angle to the inferior angle. So there is one muscle is originated from here and one muscle is inserted. Origin of subscapularis, insertion of only two muscles. Okay, then we go to the back of the scapula. Posterior surface is divided into the two parts by a spine of the scapula, that is the supraspinous fossa and infraspinous fossa. Supraspinous fossa gives origin to supraspinal muscle. Infraspinous fossa gives origin to infraspinal muscle. Okay. Lower lip of the crest of the spine gives origin to deltoid muscle. Upper lip of the crest of the spine gives insertion to the trapezius muscle. So you will find like that. Okay. Upper lip of the crest of the spine gives insertion to the trapezius muscle. Medial border of the acromion gives insertion to the trapezius muscle. So trapezius, insertion of the trapezius from here, upper lip to the medial border of the acromion. Okay. And at the lower lip of the crest of the spine gives origin to the deltoid, and it is continuous along the lateral border of the acromion, lateral border of the acromion, like that. Okay. So lateral border of acromion, you will find the deltoid. So deltoid is here, here, and here also. Trapezius from here, inserted here, and here also. Okay. Fine. Now we talk about the posterior surface of the medial border. So here at the anterior surface of the medial border you have got the insertion of what? Serratus anterior muscle. Okay, here you will find the serratus anterior muscle. Done. Now at the posterior surface, you must remember that the medial border gives the insertion only. Okay, at the anterior surface itself or at the posterior surface. So you will find the insertion at the posterior surface of the medial border also. So the posterior surface is divided into the three parts. Superior angle to the root of the spine, opposite to the root of spine, from the root of spine to the inferior angle. Okay. So three muscles will get inserted from one into the one part. That is one muscle ho gaya. It is opposite to the root of spine. One muscle is there, and from the root of spine to the inferior angle there is one muscle insertion. Okay, so there are three muscles on the posterior surface of the medial body. Okay, so this muscle is called as levator scapulae. Levator scapulae muscle is inserted from the on the posterior surface of the medial border from the superior angle to the root of spine. Okay, next is the rhomboid minor muscle. Rhomboid minor muscle is inserted into the opposite to the spine. Rhomboid major muscle is inserted from the root of spine to the inferior angle. Kahan pe? Where? Posterior surface of medial border. Posterior surface of medial border. When we talk about the posterior surface of the lateral border, you will find teres minor. First of all, you will find the teres minor. It is divided into the upper two-third part and lower one-third part. So in the upper two-third part, you will find the origin of teres minor muscle. Lower one-third part, you will find the origin of teres major muscle. Inferior angle gives origin to the dorsal. Okay, so we have talked almost all the muscles. You will find at the glenoid cavity, you will find the two tubercles. Supraglenoid tubercle and infraglenoid tubercle. Supraglenoid tubercle gives origin to long head of the biceps. Long head of the biceps. Here, long head of the triceps. Origin of long head of the biceps and long head of the triceps. Supraglenoid में biceps, infraglenoid में triceps. Short head of the biceps, because biceps. What do you mean by biceps? There must be two heads. No? Biceps, the biceps. Triceps, no? Three heads. Yes. Quadriceps, four heads. Okay. So when we talk about the biceps, the one head is long head is originated from the supraglenoid tubercle. Other one is short head of the bicep, which originates from the tip of the coracoid. Okay. And one more muscle is originated from the superior surface of the coracoid process, that is the pectoralis minor. Pectoralis minor. So this was all about the muscle attachment of the scapula. When we talk about the clinical anatomy, there is a paralysis of the serratus anterior muscle. When there is a paralysis of the serratus anterior muscle, so there is a clinical condition which develops called as winging of scapula. Winging of scapula. So this was all about the clinical anatomy of scapula. Done.